Okay, I've got a depressed patient in front of me and I want to decide whether it's okay to simply dictate a letter to the primary care mental health services for further assessment, or whether I should actually speak to the A&E liaison nurses for immediate attention. I've already got my smart card in the system and have therefore launched a map of medicine, and it recognises that I'm a Tameside and Glossop clinician and giving me the Tameside and Glossop view. I'm typing in depression into the search engine, and this shows me the primary care presentation for depression, so I click on that and I can see here the definition of depression, the diagnostic criteria that I might want to consider in order to make that diagnosis, and things I want to think about. Consider differential diagnoses including other psychiatric presentations such as bereavement, postnatal depression, adjustment disorder or generalized anxiety, medications that can often cause a depressive-like illness, and other conditions that can often present as though they are depression. Look at the history and examination, including reminding me of the mental state examination. I've decided this patient has depression and it's major depression. Are there alarm signs? And I'll be checking here whether the patient's got risk of suicide, risk to others, risk of neglect, risk of using drugs or alcohol, static symptoms or severe agitation, which the patient does have. Because of that, I click on yes, and it's now advising me that in all cases be sure to speak to someone over the telephone. And at this point, I'd pick up the phone, speak to the A&E liaison nurse and ask for her further